Right, I think I shall get started. Thank you so much for being with me this evening. I'm going to be talking about extremities, something that we all have, something that gives us pain to every single one of us. What I'd like you to do is just think about your own bodies. Think about what has been giving you some grief over the years, perhaps. Enter any questions you have in the chat, and we'll address them at the end. As far as I'm concerned, I have been in this game for a long, long time. Everybody will suffer from extremity pain at some stage. I know I certainly do. I've had them all. Literally, I've had foot ankle pain right now. I've got a strap for my elbow from all the adjusting that I do, but I'm okay. I know how to manage it. I want to pass on some of my tips and my tricks tonight. Tonight, this is about. I'd like to give you some solutions for a pain-free life. I think that we all know that we're going to suffer some pain as we go through life, but my purpose today is to try and prevent future problems, prevent reoccurrences, and to assist you, if you have something, to recover as to the greatest, with the greatest possible effect. In effect, I don't want you to be, I say this every time, I don't need you to become a chiropractor, but I want you to start thinking like a chiropractor, because it really does help you in all sorts of problems that you have with your body. It teaches you how to think, and it teaches the questions that you need to ask. So I'm sure we all remember when we were young. Look at that girl, moving freely, gracefully, no pain, no encumberment, no stiffness. Don't you wish that we could spend a few more years like this? I know that I certainly do. But we are all miracles of evolution. We are amazing machines, and our joints, of which we have 360 of them for our 206 bones, they're all designed to last a lifetime. We are designed to move, and that's what our joints allow us to do. Our joints they give us locomotion, the ability to move. They hinge, they allow us to lift, and pull, and twist, rotate, all these things that joints do. They literally allow us to pass through life in a way that is enjoyable, and it helps us get around and express ourselves and do all the jobs that we need to do. The problem is that we're actually living longer than perhaps we were intended to. And we've created a world that's very unnatural, and it really is playing, it's taking its toll on our bodies. Today, I'm not going to be talking about all 360 joints. I'm going to talk about the big four that I'm dealing with every single day. I know quite a lot about these joints. I've had problems with my hips, my knees, elbows, shoulders. Recently, my wife was suffering from a frozen shoulder. I'll talk a little bit about frozen shoulders. I myself, I've got some golfer's elbow going on. We'll come to that today. But basically what you're going to find out is the same principles applied to most joints. So think about how you want to be in the future. Look at this lovely old couple here. Don't they look great? They look like they're enjoying themselves. Obviously, they can move well. This is what we want. But I think that most of us have got something, perhaps a weakness. We call it our Achilles heel. So we really should understand what is our Achilles heel so we can do something about it. Who is the highest risk for developing joint problems? Well, obviously the elderly, because they've been in the game longer, right? People who are sedentary, I mentioned that. People are sitting all day, it's changing their bodies, we're stiffening up, we're not moving so much. It's not what we are designed to do. And then of course, sports people. The Olympics are on right now. I've just watched Joseph Schooling in the swimming just this moment. They will all have their chiropractors with them, because the chiropractic keeps them in alignment, it keeps them strong, and they are able to train harder with their joints breaking down. So I want you to think, I've written there at the bottom, think about your weight-bearing joints, because it's your weight-bearing joints and the quality that they're able to sustain as you go through life. It's the quality of these joints that enable us to navigate life. So what I think I'm talking about really is health span, not lifespan. We want to be healthy for as long as possible. And that absolutely means we've got to have healthy joints. Okay, so I'm going to focus today on the 4 big ones. And while I'm talking about joints and movement, there's a little quote here that I really like by the author Carol Walsh. I quote, "Movement is a medicine for creating change in a person's physical, emotional, and mental state." And that is absolutely true. If you don't move well, if you're achy and in pain, your emotional state is going to be affected, mental state, and certainly your physical state is. In today's crazy world, the one thing that is almost guaranteed to improve our physical, mental, and our emotional state is to be able to move, to be able to exercise. And of course, we need to be in the game a long time. We need to be able to exercise throughout our lives. So let's move on to these 4 joints. I'm going to start with the shoulder. The shoulder is the most unstable joint and the most movable joint in the entire body. Shoulder pain affects 1/4 of adults at any time. I know that in all our clinics, we see well over 1,000 people every week. I think in our clinics, probably pushing half of the people who come in have got shoulder problems. Maybe not the shoulder joint, sometimes it's the shoulder blade area. It's a very, very complicated joint, and the injuries become quite involved, and they become known as syndromes. So let's just understand a few things about our shoulders. Because they're a complicated joint, many things can go wrong. And there's a little list here, and you're gonna hear me mention these words a few times because these can pretty much apply to most of your joints. Sprains, strains, tendinitis, bursitis, what's that? Well, we'll find out. Muscle and tendon tears, instability, arthritis, impingement, frozen shoulder. These are all things that can happen to the shoulder. Let's learn a little bit about why it happens and what's going on. So the anatomy of the shoulder. I think we know it's a ball and socket joint. That's why it's got such a wide range of motion. It has 3 main bones involved: the humerus, which is the top of our arm, the clavicle, which is this one here, and the scapula at the back. Okay, and between these 3 bones, there's 2 joints: the acromioclavicular joint, which is between the top of the scapula and the clavicle, and the glenohumeral joint, which is the ball and socket, where the humerus meets the outer edge of the scapula. More shoulder anatomy. You've probably heard of the term rotator cuff. Well, there's 4 muscles and tendons. Tendons are the attachments of muscles to the bones. And it's these 4 muscles that allow this wide range of motion that we're meant to have in our shoulder. We also, of course, have the biceps at the front, we have the triceps at the back, and we have the deltoid, which is the big shoulder muscle on the top there. All these muscles have got insertion points that pull on the bones. What can happen to these? Well, they can get inflamed, they can get irritated, and that becomes tendinitis, which is, I'm sure all of you have had tendinitis at some time. I know that I have, I've got it right now. And it's just, if it has itis on the end, it's inflammatory. And in fact, every single one of the conditions I'm going to mention tonight, they all involve inflammation, okay? Crossing all the joints are ligaments, and these create stability and prevent dislocation. If we have a problem with the ligaments or the actual joints, then these are known as sprains. And if you get a sprain in the shoulder, then obviously it becomes difficult to lift the arm above above the shoulder. So some of these syndromes that I mentioned, complicated joint, there's a lot going on. So you may have heard of the word bursitis. The bursa are they're slippery, fluid-filled sacs that cushion the shoulders, and they allow things like tendons to rub without irritation. But if they're overworked, they can become inflamed, and so the bursa becomes inflamed, so it becomes bursitis. I've mentioned tendonitis, the insertion points where the tendons pull on the bones. So this is probably the most common source of shoulder pain. And then we can get impingement when lifting overhead. If you're doing that a lot, so for example, if you're working overhead, a painter or maybe a carpenter or something like that, then sometimes the tendon, which is the insertion of the muscle on the bone, that can get pinched either between the bones or under a bone. And then it becomes irritated, it becomes inflamed, and then you've got an impingement. It can be quite painful and quite debilitating. Again, it becomes inflammatory. And then we have frozen shoulder. Frozen shoulder is known as adhesive capsulitis. And what's happened is that due to a lot of stiffness, restriction, usually due to some kind of injury, due to overuse perhaps, or maybe you've had a sporting injury or something like that, but you've had inflammation, you've had immobility for too long, then you've got adhesions. And then the capsule gets a bit stuck and it becomes all inflamed and it becomes immobile, and you start to get scar tissue forming inside the joint. Very, very, very painful, very debilitating, and we've really got to get that range of motion back as quickly as possible. All these syndromes, all these things that I'm mentioning, ice will help. Ice puts the cool into the joint, and that decreases inflammation. Sometimes we need to rest, but in all of these things, we need to gently restore range of motion. Range of motion. Some people ask me, why does my shoulder hurt so much at night? Well, all these things that I've mentioned there, they are all associated with inflammation. There's pressure in and around the joint. At night, we're not moving the rest of our body, so our mind can focus on what is painful. So it tends to feel worse. That stiffness and pain seems to get worse at night. So really, before you go to bed, you need to try and get something inflammatory inside you, some turmeric, plenty of fluids, and perhaps maybe some gentle motion to get some movement in there, and maybe ice it before you go to bed. Okay, it can be very, very painful. So just run through some healing strategies for the shoulder. I've mentioned rest. Sometimes you may need a sling, but you don't want to be resting too long, because we really need to get things moving, because we don't want to risk getting this frozen shoulder. Okay, ice I mentioned, just to bring down inflammation. Of course, anti-inflammatories. Being a chiropractor, I will always favor more natural, so turmeric, etc. But obviously there are things like ibuprofen, Nurofen, or aspirin. These are over-the-counter anti-inflammatories that can probably help you. Okay, but the most important thing with all of these is to restore function of the affected joint as quickly as possible, but gradually and respectfully. We don't want to be doing damage. So there are times when we need rehabilitation. If we don't understand how the muscles work, then it's probably better to see a rehab expert. We have a rehab expert in our capital Tower Clinic, Grace, and right at the end, if you hang on to the end, I'm going to offer you some kind of easy way to get in to see her that might save you a few dollars. And then, of course, chiropractic. We are all about function and alignment and posture. Now, while I'm talking about alignment and posture, we know, and I hope you know, that we're becoming a nation of people with bad posture. Unfortunately, that creates tightness across the shoulders. Many of you listening will have tightness across the shoulders. Now, this creates something that's called upper cross syndrome, which I have mentioned many, many times. For every muscle that fires, another muscle is turned off to allow the movement. And this is a natural reflex. I think it's understandable, right? But if we've got some tightness, chronic tightness in the shoulders, there's going to be some chronic weakness at the front of the shoulder. So then you've got some instability in the shoulder, and that eventually, if you work your shoulder hard enough, is going to end up with a problem. Okay, so we really, in chiropractic, we're very much about realigning and restoring function and allowing the body to heal naturally. Okay, I hope that makes sense. Of course, there are times when we have got to see a doctor. For example, if you've had an accident, if your shoulder's looking deformed, it could be, you might have a dislocation or something. Time to see a doctor for sure. If you can't use your shoulder at all, it's completely immobile, then that's probably a red flag. If the pain is so intense that you can't do anything about it, anti-inflammatories don't work, doctor. And then if the shoulder suddenly swells, and there's suddenly a lot of pain, then again, probably see a doctor. And then another bit important one is that if your hand becomes weak or numb, then we've got some nerves involved here. So this is probably a time to see a doctor. Okay, so just to recap on the shoulder, it's all about bringing down inflammation. It's about making sure alignment is correct and making sure we've got full range of motion, okay, in all directions. Now, this quite often is a process, and sometimes we need to sort of hold your hand and show you what you can do and what you really shouldn't be doing. Okay. Any problems with the shoulder, then perhaps you can come on to me on the chat. So let's move on to the hip and the SI joint. Now, the hip is the body's largest ball and socket joint. Lots of people end up with hip problems. Wear and tear is probably, is definitely the most common concern. Why is that? Well, it's a weight-bearing joint, and alignment is a huge issue with the hip joint. What is interesting is that quite often the origin of the pain is mistaken, and it's quite a complicated part of the body. And sometimes people feel that they've got low back pain, and it's not, it's the hip. Sometimes it's pelvic pain or SI joint pain. Hip pain is something, you can identify hip pain, it usually happens when you're walking and putting weight on or rotating the leg. And it's very much felt right in the hip, right in the groin area. It is quite hard to identify sometimes. And when you look at this, it's really quite easy to understand why it's quite hard to identify sometimes, because it's a complicated joint. It's a highly complex, highly functional joint, and it involves various parts of your anatomy. You've got this immovable pelvis, you've got this movable lumbar spine above it, and then you've got these highly movable hip joints. And then you see all these muscles there. Each muscle has got a tendon attachment, and then around every joint you've got ligaments. It really is very easy to see how a misaligned pelvis can cause problems. A pelvis that's tilted or twisted, well, this is going to cause inefficiency, and ultimately there's going to be problems. If you have a look at this is just an X-ray of a client I saw a long time ago. This was a whole mixture of hip pains and pelvic pain and what have you, but it's easy to understand why. It's quite a radical one for you to look at, but we've got a situation where one person has got one leg longer than the other, so it's tilted the pelvis, causing a twist in the spine. It's caused a rotation of the pelvis. Obviously, there's going to be more weight on one hip socket. There's going to be tightness and muscle imbalance in the low back. There's going to be more weight on one side of the SI joints. So you can see how this is quite a large pelvic imbalance, but the pain is going to come from all different areas, and it really is quite hard to identify sometimes. So when we look at hips and SI joints, and we're looking at how we can help them, then we get back to this same list again. Now, I'm really trying to help you think like a chiropractor. If you've got pain in a joint, then rest it. Apply some ice, because I guarantee there will be some inflammation going on. Perhaps get some anti-inflammatories inside you. I take turmeric every day because I want to keep the inflammation down in my bad joints and systemically, actually. We want full range of motion in these joints. So if you're stiff, you need to stretch them more. Look for areas of stiffness. Do whatever it takes to get full range of motion back. Only then has the body got a chance to heal properly. There again, we've got rehab therapy. Somebody might need to help you do the right stretching and help you overcome the restrictions. And then chiropractic, again, what are we doing? We're balancing the pelvis. We're looking at structure and function. We're making sure the weight distribution on the hips is equal. We're making sure that we don't have a rotated pelvis or a twisted pelvis and things like that. Okay, really, the hip and the pelvis, it's going to trouble everybody at some stage. But I strongly believe, it's where your mindset goes when you develop these problems. What's the first thing you do? What is your default action? Is it just reach for the drug packet to anti-inflammatory, anything to take the pain away? Or do you go to the medical doctor for some drugs? Or do you go to an orthopedist? Or perhaps, is it a good idea to have a standing x-ray? Let's look at the alignment of the pelvis and the joints. Let's see where there's more pressure and more weight on the joints. Let's look for a reason for an imbalance and an abnormal wear and tear. This is what I do. This is what I've done with all my joints that I've suffered from. And if I just go back to my history, I've been around the block a few times. I played very serious rugby for 20 years. I've been a mad skier, many skiing accidents. I've had high-speed motorcycle accidents. You name it, I've done it. And I've damaged almost every joint. When I look at most of my joints, there is wear and tear. I should probably have more pain than I suffer from, but I'm really good at getting my mindset in the right place. Every day I'm taking my anti-inflammatories. I'm constantly working on alignment, stretching, strengthening where I need to strengthen. So I'm in control. Okay, I really am determined not to become a victim of these joints, and it all starts in the mindset. Okay, so I really am here to try and help you. So let's move on to elbow pain. I mentioned right now I've got elbow pain right there. We'll come to that in a moment. The elbow pain. Let's think what the elbow. It's not weight bearing. It's not so prone to long-term and chronic pain. The elbow normally involves things like sprains and strains. Tendinitis is the big one, and obviously we can get some arthritis. The elbow, the number one, the big thing is tendinitis, and the tendons, again, a tendon is where the muscle in the forearm pulls on the joint at the elbow. Okay, so you've got joints on the outside and joints on the inside. If we have pain on the outside, it's muscles on the outside of the forearm pulling on the elbow joint, and if that pulls all the time, you can get epicondylitis, which is inflammation. Let's just go to the next one. So this is called tennis elbow. The muscle on the outside of the arm pulling on the elbow joint right here. It causes inflammation, irritation, swelling and pain. Okay, this is tennis elbow on the outside. If it's on the inside, it's the muscle on the inside of the arm. It's pulling on the arm right there. This is what I've got right now from all the adjusting that I do in the clinics. What do I do? Yeah, I sit if it flares up. It's only been a problem for a couple of weeks. I'm sure I'll be over it within a couple of weeks. Why does tendonitis take a little bit of time to get over? Because these tendons don't, unfortunately, have a great blood supply. So healing can take a little bit of time, but just do the right things, ice it, get the movement back in there, do the right thing, and it'll be okay. So let's just go through what we do. So this is for the elbow joint, epicondylitis. In the illustration there, you see a strap you can put around the elbow. There's my strap right there. I put that on when I go into an adjusting set, and I'm putting a lot of force through my arm. My other solution is I rest it when I can. By using the strap, it's taking the pressure off. It's giving my joint a bit of a rest, actually. I do ice it. Anti-inflammatories, I mentioned I take turmeric every day. I have an anti-inflammatory diet. I can't do much more than that, so that's what I do. I use the strap. I do alter my technique when I'm doing things, when I'm lifting things. So think about technique. If there's something that you're doing repetitively that causes these problems, then look for another way around. Maybe use the other arm, whatever it takes. I don't know. Okay. Now at the bottom there, I put eccentric exercise. Let's understand what that means. And we know that things want to heal with full range of motion. So I know that while it's healing, I don't want it to heal and form scar tissue. I want it to heal and form very functional tissue. I want to be as good as new afterwards. So during the healing periods, that's going to be the next month for sure, I'm going to be going through full range of motion quite a lot. Now, if I do eccentric exercises, so I've got a little weight here, and now I'm going to use my good arm. An eccentric exercise is if I'm shortening the muscle, and that would pull on my elbow. If I did that with my bad elbow, it's going to cause pain. I'm causing strain on my elbow. So what I'm going to do to exercise it, I'm going to do an eccentric, not concentric, eccentric. So I'm going to lift my hand up with my good hand. And so the muscle is now shortened, and I'm now going to just let it down slowly. So I'm lengthening the muscle nice and slowly. Okay. If I shorten the muscle, it's going to cause pain. I'm lengthening the muscle. So it's enabled me to put a little bit of strain on the elbow, but not too much. And the arm and the joint is going through full range of motion while it's healing with a little bit of strain. A little bit of strain means that the fiber that's laid down, the healing, it's going to be good, strong, functional tissue. That's what we want. Okay, right. Who here doesn't have knee pain? I'm not putting my hand up because I get some from time to time. In fact, I know an awful lot about knee pain. I'm going to go back to my story. When I played rugby all those years ago, unfortunately, I didn't know at that time that I was suffering from some flattening of my arches in my right leg. So I got flat feet, and I was running around on the hard rugby fields of Northern England with flat feet. And so my feet were rolling in. So the inside of my knee was out of alignment. And over a period of probably 10 years, I gradually, basically, I burnt a hole in the cartilage in my knee. And I started getting pain. I took anti-inflammatories for a while. Eventually, I had a terrible problem. Eventually, it was the end of my career at the age of 38. I had to have surgery. I had to have cartilage transplant. But luckily, I then went to chiropractic school. I learned how to heal properly, and my knees are back to being as good as new. And I'm skiing and cycling and all those good things. So I know quite a bit about this. So let's see what we can learn here. Chronic knee pain, unfortunately, affects 25% of adults, right? So hopefully that's not you. It is me. It limits mobility, quality of life. It's mostly down to wear and tear. You can see there, I've written there, when you're walking, 1 pound of weight. So if for every pound of weight that you carry, there's 4 pounds of force going through that joint, that knee. 4 pounds of force. If you're running, it's a lot more. If you're running downhill, it's going to be a lot more still. Okay, so think about it. You know, one of the great things to do when you've got aching hips and knees can be to lose a few pounds. That in itself can help us enormously. The knee is basically a hinge joint, so it hinges, but it also allows some twisting. When you understand the trauma that goes through a knee, it's very easy to understand how deep it is. I think somebody hasn't muted their microphone, and they're making a noise that we're all enjoying. So perhaps you could make sure your mic is muted. Thank you so much. So yeah, we want to think about alignment of the knee big time, because this degeneration that will happen with any joint that is out of alignment will cause changes that will have a huge toll on the quality of your life. All right. But however, the cartilage in your knee is designed to last a lifetime. So if you're starting to get some aches and pains, it's the body telling you something's wrong, try not to ignore it, try to work with it. What does it say? Okay. And yes, if you don't suffer knee pain, then great. But I think most people will suffer it. And if you don't suffer any pain, then go ahead and tell me on the chat. I'd like to celebrate that with you. But there are some simple things that you can do to give you the best chance, right? And we'll come to that in a moment. These knees are they are traumatized every day by the 10,000 steps that we take. These are some of the things that can happen to our knees. Most of them have got itis on the end. So itis means inflammation. So if you're getting tendinitis in the knee, it tends to be at the front of the knee. For example, it might be made worse if you're walking up or down the stairs or walking up a hill, pulling on the front of the knee. That's more likely to be tendinitis. Many of you will have heard of bursitis. Well, the bursa in the joint, it's a slippery little sack of fluid, and there's a few of them in the knee. And it allows tendons to rub against bones without fraying. So it just allows things to move without trauma. But if you've got some kind of repetitive injury, then this can create swelling in the bursa, and you've got bursitis. Okay. Some of you may have heard of chondromalacia patella. Sorry, also known as patellofemoral syndrome. This is something that I was told I had when my knee started to hurt. It's basically a little bit of wear and tear under the patella, the kneecap, where it slides over the bone, which is the bottom of your femur, the condyles at the bottom of your thigh bone. If it's not straight, if you've got a twist in the knee or something like that, then you're going to start to get wear and tear in the underneath of the patella. This can very often lead to wear and tear in the cartilage, which is the start of osteoarthritis, okay? Which is basically wear and tear of the joints. It's typified by problems in the cartilage. You can even develop tears in the cartilage and eventually bone spurs. And I know that there are people watching that have cartilage problems and bone spurs, etc. So think about it. These will have been caused by dysfunction, misalignment, weakness, or too much tightness that's pulling the joint out of alignment. Or there's been some kind of trauma in the past. And so we want to come to, how do we give ourselves the best chance to heal the best we can? Once we've got some kind of trauma, damage, it's probably not going to go away, but it doesn't mean it has to be debilitating. And we want our joints to last the best that they can. Of course, the knee joints, we have ligaments. They can get damaged. You've probably heard of ACL and PCL, the cruciate ligament problems. And then down the side of the knees, we've got the collateral ligaments, medial and lateral, inside and out. These can all get strained and pulled and torn, okay, as of course can the muscles. Many people in Singapore are out there running. Well, let it be known, if your knees are out of alignment, then this is traumatizing the knee. So runner's knee is a very common thing. People go to me all the time with it. Again, if I can say the word chondromalacia patella, or patellofemoral syndrome is one of the main things. Tendonitis, that pain at the front of the knee, or pain under the kneecap. This generally is the cause of runner's knee, and it's nearly always not enough stretching, not strengthening the wrong joints, and then alignment problems, the kneecap out of alignment. Okay. If there is some kind of alignment that you know about, be careful, because it's gradually wearing away the joints. I put that picture in, but it's affecting my eyes. It's a little bit blurred. But what you can see there is you can see the makeup of the inside of the joint, and what you can see the meniscus. So the bones between the thigh bone is called the femur, and that bears down on the tibia beneath it. And you've got cartilage between the two, but you've got a meniscus, which is a cushion between the two, and that's a piece of tough, rubbery cartilage that acts as a shock absorber between the joints. And if you have a twisting injury while you wait on it, then very, very often it causes a problem with the meniscus, which can be torn, it can be damaged, and this can lead to osteoarthritis if you're not careful. Again, be careful with alignment. Sometimes little operations need to go, and they need to go and clean the meniscus. I'm sure you've heard of things like that. But be careful with the meniscus. Be careful with twisting. It's especially when we start to get older and our knees start to get a bit unstable. We must always be strengthening our knees. Okay, so let's have a look at the alignment of the knee there. We can see the makeup of the musculature around the knees, but the alignment of the knee that I found out myself the hard way, very, very, very important. It's important for the distribution of load, to maintain a healthy cartilage. If we're going to have efficient, balanced movement, then we've got to have good alignment. We've got to have good, strong, and quick reflexes. So those muscles that you see, they've got to be strong, but they've got to be well stretched out, and they've got to have good reflexes. And this will help avoid injury and minimize pain. Now, walking around the streets of Singapore, I'm sure you've seen people with knees that look like this. Bow legs, it's called genu varum. Very, very common in Singapore, something that I see all over Asia, actually. Now, this is going to cause abnormal wear and tear in the knees. So if this is something that's happening to your youngsters, then you should try and get something done early on. It can be caused by alignment issues early on, not corrected. It can be caused by rickets, actually. Not enough vitamin D. That thinning bones can cause some bow legs. But we also see some knock knees, so where the knees come in the middle. We see that also. Sometimes we see that with people who are putting on weight. Their pelvis rolls forward with the weight they're carrying. That puts the knees out of alignment. Or as happened to me, if you develop flat feet, the knees can roll in. Again, put the knees out of alignment. You have abnormal wear and tear, and that's going to cause problems. And then I go back to, sorry, let's go back to that one. You see in the X-ray there's somebody that's got a very simple, a smaller long leg instability problem. So one pelvis is higher than the other. You can see that that's going to put the pelvis out of alignment. It's going to twist the pelvis probably. Your knees are going to be out of alignment. this is going to cause wear and tear and knee problems, okay? So when it comes to knees, alignment is everything, okay? So just thinking about let's go through a few tips how we can help on these. I mentioned our joints are surrounded by tendons, cartilage, muscles. It's very, very important that our joints are surrounded by muscles that have balance and have both strength to hold it, but flexibility, so they're not restricted. They should go, all your joints must go through full range of motion, whether it be the hips or the knees, allowing you to move well. So I really do think something that I do every day, I check in with my body. I ask myself, do it most mornings. I'm a little bit stiff in the mornings because I spend all day leaning over clients or I'm sat at my computer, etc. I try and stretch when I can, but I've got some wear and tear, so I do get some stiffness, but I know how to stretch properly. Okay, so every day I'm checking in with my body what needs to be stretched. If I can feel restriction, if I feel stiff, I'm going to stretch it, and I'm going to stretch it in a way that builds slowly, so it warms up. I'm not going to do anything too radical. I know that stretches work effectively over time. Okay. So let's do a few more things that you can do here. We want to keep our knees healthy and strong. Almost everybody that has bad knees has got weak quads. So the quadriceps, the big muscles at the front of the upper leg, and then the calves, back of legs at the bottom. So we can do things like squats to strengthen the quads, or heel rises, so rise on your heels. Again, that's going to strengthen your Achilles and your calf muscles. It's going to help enormously. Before you exercise, it's really important that you stretch and you warm up. And we want to be stretching our big muscles, the big muscles that get short. So what could they be? Well, those quads, they get short, they're big muscles. The calf muscles, they become short from sitting all day, as do our hip flexors. So we should be stretching our hamstrings and hip flexors every single day, especially if you have a job sitting all day. Okay. Now let's go down to the foot support I mentioned there. Remember, every step we take transfers energy through our legs and straight through our knees. Right? We need our knees. Our knees must be in alignment. So it starts from the bottom. So our shoes forms the foundation, if you like. So many of us are losing, we have twists I see some people with their feet are out like that. Well, that's going to translate to the hip and the knees. So our feet really want to be in alignment. Our legs want to be straight. Don't let I've mentioned this before, but don't let the shoes, the feet roll in. If you need orthotics in the shoes, then go ahead and do that. And then again, we want to ensure that we're going through full range of motion. If we're losing full range of motion, we are stiffening up. If we're stiffening up, we are aging. If we're aging, we're stiffening, it's a vicious circle. Okay, so I implore you, we need to have a routine of stretching every single day. If you're not sure how, then come and see us, come and see Grace, our wonderful rehab lady. She will help you enormously. Okay, a few exercises that you can do for your knee. I mentioned before, if there's damage, then perhaps we want to be doing some range of motion exercises that are not weight bearing. So what could be not weight bearing? Cycling. I use an elliptical machine where it's a gliding motion. I like that. Swimming, I do a lot of swimming. Some people like to walk in water. So again, that's getting good movement through the joints. Some no-nos for your knees. If you're working your knees, if you've got slight discomfort, it's okay. But any sharp, sudden shooting pain, anything like that, it's time to stop. ice it, get it up. There is an acronym RICE, so rest, ice, seek, compression. If there is inflammation on the joint, then you can bandage it, you can put some compression on, and then E is elevate. You can raise it up to allow the swelling to drain down. Okay, RICE. RICE stands for rest, ice it, compress it, and elevate it. Okay. Right, so let's just, a few simple prescriptions. I've come to the end now. A few prescriptions for strong, healthy joints. Like everything, we are what we eat. If you're not having a good diet with whole, real food, rich in micronutrients and enough vitamin C to help you create good tissue, then you're not maximizing your ability to build strong tissues. Asking for trouble. If you're not getting enough vitamin D, you're developing, and unfortunately, you're going to have weak bones. So you've got to get out there and get you enough vitamin D into you. Quality sleep. This is your body when your body does the building and repair when it gets into deep sleep. These are just simple things that I'm trying to make you think a little bit like a chiropractor, as I said. There are many conditions, autoimmune conditions, that lead to problems of joints. So things like arthritis, rheumatoid arthritis, these are autoimmune conditions where the bodies are attacking your joints. These are generally coming from problems with the gut. Okay, so we've got to have solutions for a healthy gut. One of the big ones, obviously, you've got to eat well. But you've got to, solutions for de-stressing yourself. If you're stressed, it's affecting your immune system, it's affecting your digestive system, it's messing your gut, and that's creating a situation whereby you're probably going to enter into a situation whereby you've got inflammatory conditions. All right, look after your gut. Daily movement. We need to be moving every day. I keep quoting this fact, I don't know whether it's true or not, but I read it somewhere, that our ancestors used to move 200 times more than we do. Now, I move a lot, so I'm not sure whether I apply, but I certainly see people sitting at computers all day, every day. I really can see that statistic, that the fact that our ancestors moved 200 times more, it could well be true. So really, we've got to stress our bodies more. We've got to put energy through our bodies. We've got to work our bodies. Remember, use them, use our joints, use our bodies, or lose them. Okay. And then right at the bottom there, maintain optimum alignment and range of motion. Okay. And then last, people ask me all the time about supplements. What do I take? Well, this is what I try and take. Glucosamine I do take every day. Collagen, your joints, all our tissues, our connective tissue is made from collagen. So a good source of collagen is good. Bone broth, good healthy bone broth, probably the best source. Fish oil I take every day. Curcumin, which comes from turmeric, probably the best natural anti-inflammatory. Okay, so I've flown through a lot of stuff there. We'll have a look at the questions in just one moment. I want to thank you for listening to me. Have a look at this slide. This is not your opportunity to visit Grace. Grace is our wonderful, wonderful, wonderful rehab girl. She's in Capital Tower. She's an expert at all these joints that I've mentioned. If you are not an expert in helping your joints heal, then this is probably a good call. $60 will get you in to see Grace. It's normally $100, so we've given you a bit of a deal there. If you want to email us, then info@totalhealthchiropractic.com.sg. If you quote THC Rehab, just to make sure you get that, but just say that you were on Dr. Tim's webinar and you'd like the deal. That should do the trick. Okay, I'll leave that for one more second. You want to take a photograph of it, and we're going to come to the last slide. Any questions? If you want to address me, talk to me, ask me any questions. I do answer questions. I do not hide. There's our website. There's my email address. Go ahead and you can address me whenever you want. Okay.
Okay, Tim, there's lots of questions.
Oh, I had a feeling because I know that everybody suffers from problems with
I'll help you read them if you like.
Okay, go ahead.
So Zoe wrote the first question. This was when you were talking about the shoulder pain, shoulder joint. And she says less exercise and movement to prolong the good condition of the joint.
Right. Okay, so less exercise and movement to prolong the good condition of the joint. Okay, well, right. Okay, well, joints are joints and joints are designed to move. Use them or lose them. So we can't not exercise them for long. Yes, we might, if you've got damage, you might need to have a sling, you might need to rest it for a while, but you simply have got to get range of motion. So how are you going to do that? You're going to reduce the inflammation. You're going to maybe have a little bit of rehab, but you've got to get range of motion back as quickly as possible. Ice, anti-inflammatories, and then maybe rest for as long as you need, but as soon as possible, you do have to get the range of motion back, okay? When to start, there's a bit of a juggling act. So extreme pain, probably not. If it's a little bit of discomfort while you're going through range of motion, I think that's okay, all right? So, if this is a problem, do see Grace. She will work with you and give you the best possible chance, okay?
Okay, thank you. And then 2 questions about sleeping. Someone's asking, can sleeping sideways with head resting on the arm cause pressure to the shoulder and pain afterwards? And then David's added to that he usually has numbness whenever he sleeps sideways.
Right, okay. So a couple of questions there. So if you're sleeping on the side, then I put a slide in about night pain because that's a time that people do wake up with pain. It's inflammatory. Inflammation always causes pain. It also causes fibrosis and scar tissue formation. So that's why we need to get the movement. If you're sleeping on your arm, if you're sleeping on your shoulder, that's causing, your head is very heavy right there. So that's putting a lot more pressure on it. That's probably not a good idea. Just to go to David's there, if you're getting some numbness, so numbness is normally associated with the brachial plexus, which is where all the nerves come out of the spine in the lower neck, or in the nerve roots. So it's either a neck problem or a shoulder problem. So if you're sleeping on your side, probably pull your shoulder underneath and try getting your head back so that you've got a nice curve in your neck. Make sure your pillow's doing its job, supporting it, so your head is not down or too far up, okay? So always think that you're looking for a neutral spine, okay? Obviously, you can experiment, sleep on the left, sleep on the right, what works best for you, all right? That's really all we can say. Try and work with your body. If you can find a comfortable position, then that is your position. It's not good if you're getting numbness. It's usually something to do with the low neck, actually. So it's probably a sign that you might need to get checked by a chiropractor. Okay, but try sleeping with your head back, not forward, because that's stretching the nerves.
Okay, you can also find our talk on sleeping posture on our YouTube channel if anyone's interested. Linda's asking, she's seen the doctor and was told that her alignment from her hips to legs are fine, but my cartilage has gone on the left kneecaps and my joints are nearly touching each other. He said an operation to be done in 4 years' time. When I squat down, my kneecaps are very painful. What can I do to take away the pain?
Right, this is for you, Linda. So, okay, so I feel for you. I totally understand. I see clients with this type of presentation all the time. So as I mentioned, it's high, unless you've had some kind of trauma. So you've fallen down a mountain, or you've fallen off a bike, or been hit by a taxi, then it's more likely that it's been wear and tear through all those 10,000 steps you've been taking over all the decades you've been moving through life. So what can we do? So we know that we've got to keep them moving. We want to put off surgery if you're destined for surgery, because this type of damage tends not to go away. It doesn't have to be debilitating though. If we can put surgery off the latest possible, then that's a great thing right there. If we can minimize the pain and discomfort, that's a good thing right there. So to give you the best chance, again, think about technique. So I'm thinking about the technique of walking. So we've got to make sure that your pelvis is straight, your knees are straight. We make sure that your muscles aren't too tight. So make sure that you stretch. Is there any tightness around those joints? You've got to stretch them out. It's highly likely that some tight muscles have pulled your knees out of alignment over the years. So just by stretching them out, that can help enormously. And taking anti-inflammatories, okay, that will help. You know, I think the arthritis, the osteoarthritis that you've mentioned, the bone spurs and the cartilage being worn away. I think taking fish oil definitely helps. Turmeric definitely helps. Myself and my wife, we take glucosamine every single day. There are numerous studies that say that it works. Do I know that it works for me? Well, I actually daren't not take it. I know that when my wife stops taking it, she starts complaining of knee pain as well. So we take it. That's glucosamine. Chondroitin is something very similar. Cod liver oil, again, omega-3s. This is all good stuff for the knees, anti-inflammatories. I think you need to exercise your knee. Exercise is going to bring in blood. Blood is how the body brings in the chemicals of repair. So we need to get blood to the tissue. We need what little cartilage we've got to deliver blood to it and the chemicals of repair. So I really do think that you want to get a lot of motion through the joints when you are not weight bearing. So, go walking in water, walking in the swimming pool might help. Myself, when I destroyed my knee and I had my cartilage transplant, I honestly was so scared. I thought I was never going to walk again. My knee was literally that size compared with that size. I was so worried. I moved to San Francisco. I started chiropractic school. I learned very quickly about alignment. I bought a bicycle and I rehabbed my knee cycling up and down the hills of San Francisco. And I was there by myself for 6 months. This is what I did every single day. And it really worked. It helped me. So cycling, your knees are in alignment. You don't just start gradually getting some movement through there, just getting the movement, bringing in the blood, and that's delivering the chemicals of repair to the cartilage, okay? And we want to strengthen the right muscles and stretch the right ones as well. So when you squat, your kneecaps are very painful. Yeah, I understand. So I think that once you've stretched out your muscles enough, perhaps you've strengthened the ones that were weak. Once you've spent time delivering anti-inflammatory chemicals to the knee, and you get some range of motion exercises that are not weight bearing, I think that your knees are going to work better. I also think that you've got some damage in there. I think your knees will tell you more often than not that you've got some damage. But if we can keep you going, reduce the pain by 70 or 80%, maybe that's a good result. I know that when I'm aching, I check in with my joints. What is it telling me? Do I need more anti-inflammatories? Do I need to improve my alignment? Do I need to stretch more? Usually it's all the above. Okay, Hope that
Okay.
helps.
So we're actually at 7:30 already. So everyone's very welcome to stay on the line while Dr. Tim answers the questions. Alternatively, if people have got to go, then please you can feel free to email him and he can answer you personally. But we'll work through these fairly quickly now, I think. So,
Yeah. I just add that this is being recorded, so this is going to be posted on our social media. If you have to go, then you can pick up the recording later.
Yeah, so you talked about mindset. Can you elaborate more on that?
Yes, I can. Mindset is my number one thing. Look, if you want to be healthy in this world, you've got to be proactive. You have got to develop a relationship, a loving relationship with your body. You cannot just expect it to be healthy. The food we're given tends to be rubbish. The posture that they put us in tends to be rubbish. You know, we don't have a chance. So you've got, you know, you can probably tell by the way I'm talking. This is a real passion. Please start to think about your body, develop a relationship with it. What is it telling you? Check in with it every single day. So my mindset is you know, you've got to think about the pillars of health. This is why chiropractic for me was my number one thing. I could have gone and I could have become a medical doctor, but I didn't want to spend my whole life giving drugs to people. Chiropractic is about life and what makes us live. What gives us the best chance to have a long, healthy, vibrant life? Well, it's not going to medical doctors. It's actually employing a mindset whereby you look after yourself. I call this a wellness lifestyle, whatever. But you know, this mindset, it's you know, is what I've developed, and it's what I'm constantly talking about and teaching people. Okay, it's proactive, giving your body what it needs, taking away what it doesn't need. Right? Remove toxins, give it what it needs. Give it exercise, take away that sedentary lifestyle. I think that makes sense.
Okay.
Hello.
Back onto bending legs again. When I bend my legs backwards, muscles behind the knee are in pain. What's the cause?
When you bend your legs backwards,
Right.
your legs backwards, muscles behind the knee is pain. Not quite sure what you mean there, but if you're just flexing your knee, so I'm sitting and I'm bending my leg backwards, the muscles behind the knee is painful. So if it's right behind the knee, then if it's right behind the knee, then almost certainly you've got inflammation in the knee. There is restriction and it's causing a problem. Remember, around the knee, you've got those tendons, maybe some tendonitis. If it's pain in the knee, maybe you've got some kind of tear so remember, we get sprains in ligaments, we get strains in tendons and muscles. So maybe there's some inflammation in the knee, which can be coming from abnormal alignment, causing maybe some inflammation in the meniscus. It could be a number of things. So look at alignment, and look at range of motion. Get that range of motion back as quickly as possible.
Okay, then a couple of questions here which we put into one. It's about cartilage. So what type of doctor specializes in cartilage replacement? For osteoarthritis, will cartilage replacement help? And then from somebody else, is cartilage degeneration due to aging, and what is the recourse available?
Right, okay, cartilage, one of my favorite subjects. Okay, so the cartilage is the smooth inside of a joint that allowed joints to move freely. It will last you a lifetime unless it's traumatized. So if you play rugby like I did, if you take lots of hit, you're probably going to damage your joints, or joints that are out of alignment. Okay, is it due to aging? Well, joints that are out of alignment are going to age much faster. If you're not getting enough fluids, if you have a poor diet, if you have an inflammatory diet, these joints are going to wear badly. So to give your cartilage the best chance, you've got to feed it well. You've got to exercise it well. and you definitely need good alignment. If you have degeneration in the cartilage, can it improve? I'm going to say yes to an extent. If you've damaged the cartilage, normally you've got an alignment problem. So realign the joints. So do whatever it takes to get back in alignment. That might just put yourself back onto some healthy cartilage, and that will help you enormously. Taking glucosamine, it can help. The type of doctor that specializes in cartilage is an orthopedist. Of course, I try and protect people from orthopedists. Most of the orthopedists I know are driving around Singapore in Lamborghinis, Ferraris, and Mercedes-Benz because they spend their time repairing joints that have been well traumatized. Usually it's hip joints and knees. These are joints, weight-bearing joints, generally that have been traumatized by poor alignment, stiffening. They've aged badly, so they need replacing. Generally, if you go and see an orthopedist, you're heading down the road towards surgery. I would put that off. I will be the first one if somebody's suffering from pain, tremendous pain in the hips, and I take an X-ray and I look and I see that there is no cartilage left whatsoever, and it's bone on bone. Then after a few adjustments and by getting some movement, if it really is not helping, then I myself will send you to an orthopedist. But that, to me, that would be last resort. Okay.
Okay. I have osteoarthritis stage 2. What is the recommended steps to walk? Is climbing stairs to be avoided? I have pain in the knee when getting up from sitting position, using my hand to support myself to get up. What type of issue is this? Osteoarthritis, and can chiropractic help?
Okay, well, again, I'm going to go back to the same answer for all these questions. If structure, function, alignment. If you're having problems getting up from sitting, then quite often it could be tendonitis at the front of the knee. It could be weakness in the muscle. If you've got a real problem in the joint, then the body, your brain might actually turn off the muscles and create weakness in your legs to try and protect the joints. It's something that you might have to work through. These are things that we help our clients with. I know Grace certainly does. Stage 2 arthritis. So when it comes to these notes, it depends on which doctor has told you on the stages. So to me, stage 2 is not terminal. Stage 2 is that you've got some wear and tear, and it does not have to become stage 3, and it does not have to become a joint replacement. So you do really need to make sure you have good nutrition, good alignment, you stretch the joint properly, you start to get the reflexes around the joints working properly. If it's the knee, I have people, for example, standing on a wobble board or an exercise cushion that you stand on, doing little squats and things like that, standing on one leg, creating a little bit of instability, can start to get the reflexes around the knee working, so it just becomes stronger. The body, when it's not happy, is very good at inhibiting muscles, and it's something that we need to be aware of, and that's where probably some rehabilitation, strengthening the right muscles can come into play here. It's good that you recognize where you are, but you really need to find solutions. Of course, what I don't know is how old you guys are. I had my knee problems during my 30s. I'm now into my 60s, and I'm planning to be skiing for another 25 years. So I'm going to be skiing into my 80s. Of that, I am sure, because I know how to look after my joints. And I'm trying to pass on this chiropractor's this chiropractic mindset. Pain is there to tell you something's wrong. It's not there to make life miserable, right? We need to work with the body.
Okay, thank you. What type of collagen supplement or natural food is recommended?
So I've tried a few collagen supplements in the past. It's a long time since I've taken collagen supplements, so I'm not going to give you a collagen supplement that I recommend, because if I'm going to recommend you to take a supplement for collagen, I'm going to recommend that you start doing bone broth, and you get natural organic bones, maybe from the butcher or from your own cooking, and you cook and you get all that collagen out of the bones. It's the best way, the natural way. It's the best way to get collagen that's absorbable by your body. So, and how often would you take it? Well, if you've got a problem, then you can boil some bones up, once a week, and you can take a little cupful of collagen once a day. Bone broth with some good healthy organic vegetables. I think it's one of the amazing superfoods. It's also good for healing the gut. So there's my answer.
Thank you. And Linda's just saying that the doctor's given her vitamin D. She's taking fish oil, evening primrose, calcium, and glucosamine. Probably, if there's anything to add on that, I don't know. I answered ET, by the way, later on in the chat.
Evening primrose, calcium. Well, I'll say this thing here. I would say almost nobody in Singapore is calcium deficient. So be careful if you're taking calcium. Only take calcium if you're told to by a doctor, because you've probably got plenty of calcium inside you. What you may be deficient in is vitamin D, because most people are vitamin D deficient, and also vitamin K. These are two things that are very, very important for getting calcium where it's needed, which is not in the soft tissues, and it's in the bones. Okay, vitamin K and vitamin D.
Okay.
Vitamin D is good.
There's one about knees while sitting and climbing stairs.
Got that
Kind of
one.
answered that one, yeah. What about pain at the back of my buttock in the morning and goes off eventually? Is it due to medicine?
Pain in your buttock in the morning. So again, that could be a little bit of sciatica. It could be a little bit of hip pain. It could have been a little bit of tightness. It could be a little bit of, so one thing I want you to all understand is that if you've got wear and tear in your joints, and we all get wear and tear, you're likely to wake up in the morning stiff, okay? Because we're not moving. And movement is the most important thing. I think you'll all agree with me that once you get up and about, you start moving, your joints feel better. So if you're a little bit tight and you're tight in the buttock or whatever, then just maybe sit on the bed, do a few little stretches before you get up, do a few stretches early in the morning, get your body moving, and you'll feel so much better. Okay, I think we are there. Well done, a lot of questions answered there. Yeah, that's good. Still 24 people on. That's really good. I went through a lot of stuff there. Obviously, pain does affect everybody's lives. As I said, just really start a really loving relationship with your body. I have pain every single day. Sometimes it's more severe. Usually it's not too bad. I work with it. I'm thinking about the alignment of my ankles and my feet. I'm thinking about my orthotics. I'm thinking about my knees when I'm cycling. I'm making sure I've got full range of motion for my shoulders and my ball of socket joints. I never want to get frozen shoulder. And yes, you can get frozen hip as well. It's the same thing. Frozen it's called epicondylitis, femoral epicondylitis. It's the same as frozen shoulder, you can get it in the hip as well. So if you're tightening up in the hip, you've got to get full range of motion back as quickly as possible. So I'd like to thank you all very much. Great questions. As I said, I'm here for you. If anybody wants to speak to me, you can call, you can, I don't hide. Okay, so thank you so much. Appreciate you all being with me. And next month, I'm going to be talking about the opioid problem that is all over the world. Too many people are getting addicted to pain medication. So let's see what we can do about that. Okay, thanks very much. Really enjoyed tonight. Good topic. Hope I've done some good. And I hope I'll see you in passing sometime soon. Okay, thank you very much.